health is a key indicator of overall health. Preventive care can help stem the progression of oral and gum diseases and help to lessen the risks associated with heart disease, diabetes, and pregnancy. The importance of good oral health, tonight on Call with the Prairie Doc.
Welcome to On Call with the Prairie Doc, health information based on science, built on trust. I'm your Prairie Doc guest host, Alex Bisson, and tonight we'll be talking about the importance of good oral health. Good oral health is essential for overall well-being and quality of life. Poor oral hygiene can lead to a host of problems such as tooth decay, gum disease, and bad breath. Maintaining good oral health not only prevents these issues, but also contributes to better physical health by reducing the risk of heart disease, diabetes, and other systemic conditions. Regular dental checkups and practicing proper oral hygiene habits are key to preventing these complications and maintaining a healthy mouth. Tonight, we will discuss ways to maintain your oral health, how to fix oral health issues, and take viewer questions. This evening, we are joined in the studio by Dr. Ann Harris from Brookings Dental Clinic in Brookings, South Dakota, and Dr. Paul Johnson from Midwest Periodontics and Implant Dentistry in Sioux Falls. Welcome. Thank you so much for being here with us this evening. Yeah.
Thank you.
Dr. Harris, before we start our discussion, could you please share a little bit more about your background and what interested you in the field of dentistry?
Sure. Well, our dad was a dentist, so growing up it was something that we were always around, and kind of grew up not knowing anything different. And he, of
Grandpa
course,
was a dentist.
Our grandpa was a dentist.
Grandpa was a dentist. Dad was a dentist.
Yeah, it's kind of in the genes, I guess. But I never really considered anything else. I always enjoyed spending a lot of time at the office, and you know, our dad was a pretty awesome role model, so we spent a lot of time and enjoyed it. So I did my undergrad at SDSU here in Brookings and did dental school in Lincoln, Nebraska, and then came back to Brookings
and
after
you've been
that.
practicing Brookings for?
Over 18 years.
Awesome.
So,
yeah, I love that. Yeah, such a cool background, and what a pleasure it is that we get to have a brother and sister duo here as our guest this evening. Dr. Johnson, tell us a little bit about your background, and then what is your specialty, and why did you choose that specialty?
Well, believe it or not, Ann and I are brother and sister. I have a similar story. Throughout high school, worked at the Family Dental Clinic, and Ann went into dentistry, and Dad was a dentist, Grandpa was a dentist, Aunt Marty was a hygienist. So I felt like dentistry was always a path in front of me, and it made sense. It had great role models. Went to SDSU for 4 years. Was really involved in tutoring in the anatomy lab and loved it, and ended up getting into dental school down in Lincoln. Same one as Dad, same one as Ann, and big surprise. 4 years of dental school, and then I was really lucky. I was involved in a lot of research, got tagged along in some really interesting research projects in dental school about rheumatoid arthritis and its correlation to gum disease, and was able to publish a few papers and ended up going towards periodontics, which is a specialty in dentistry.
And as we said, practicing now in Sioux Falls.
Correct.
So wonderful. I just am so tickled pink to have both of you here.
Thank you for having us.
Yes, absolutely. Before we start our conversation, though, we do invite you, our audience, to submit your questions for tonight's discussion about oral health. Viewers can contact us in 3 ways. Call 1-888-376-6225. Send an email to ask@prairiedoc.org or ask on our Prairie Doc Facebook page. We will work to answer as many of your questions as possible given the time available. Sometimes we do receive more questions than we can cover, and we apologize if we do not get to your question. Your question will remain anonymous and no information is saved. Viewers can leave their name, email, or phone number to be entered into a drawing for our Prairie Doc publication, Perspectives from the Prairie, but it is not required to submit a question. The winner will be drawn and announced at the end of this program. All right, let's do this. Let's get into some of these exciting viewer questions, talking all about oral health. Okay, let's start with the basics. And as I ask these questions, some of them might be specific to periodontics or general dentistry, but you can go back and forth in how you answer. It does not matter to me. Why are regular dentist appointments important?
That's all you.
Okay, okay. They're important just so that there's so many changes that can occur in your mouth, and especially with kids, they change so quickly, they lose teeth, they get new teeth, cavities can form quickly. Gum disease doesn't necessarily happen overnight, but there are certain,
There's a witty saying, and it's like one of those that your dentist will, I'm sure, tell you at some point, that dentistry isn't necessarily expensive, neglect is. And that's nothing that happens overnight. It's kind of a cumulative effect over time.
Yeah.
So.
If you forget to brush your teeth one time, probably not that big of a deal, but if you don't brush for months, that might turn into something.
Correct.
It sure does.
Absolutely.
Yes. So this one comes from email. It's the question is, my child does not enjoy flossing. How do I help him do it correctly? It's tricky. I know we both have kids. All three of us have kids. So how do we help a child that just does not like to floss?
Those little slingshot flossers or trucker flossers, as Chris likes to call them. Those are great for kids. And I think one thing is, if you just do it from the get-go, there's a lot of things that kids don't like, but once it becomes not really an option, they kind of realize okay, it's not that big of a deal.
Yeah.
So if they don't know any different, and you just, always floss, they do get used to it. And then just try to make it fun too, see how many contacts you can go through, count, or there's even different apps on the phone anymore, that'll play a little song and a picture will uncover when they brush.
Oh, wow.
No, it's not flossing, but
wow,
there's a lot of different little tools for kids that can make it fun.
Is a water pick a good option for a child for flossing, or does that not really do the same thing as a good old piece of floss?
It's better than nothing. It would probably be really messy.
Yeah.
Probably
have water all over the bathroom.
Yeah, but that's okay. Do it in the tub,
You can plan on washing the mirrors if you get your hands on the water pick.
But if they'll do it, great.
Yeah.
So.
Exactly. All right, Dr. Johnson, I'm thinking this one might be directed to you. It comes from email. My dentist told me my gums are receding. What can I do for this?
Well, there's a lot of causes that could lead to gum recession. One of them, and probably the most common, is just how you're made. You can have thin gum tissue, and as a result, from brushing and functioning over time, that tissue that's supposed to attach and support your teeth can recede and expose the underlying root surface. That it's really difficult. I would say don't use your teeth. Don't use them. If you do, that's going to lead to recession. So honestly, there's just some circumstances that you cannot help. The recession, the tissue loss. I always say hold your toothbrush like a wine glass or grape juice. Don't hold it like a cave woman or caveman. When you're brushing, you want to imagine gently brushing your teeth and not scrubbing. So less
electric brush too.
I like electric brushes. Same concept, same holding your toothbrush like a wine glass. I think the biggest thing is just not being too overzealous when you're brushing.
You mentioned the electric toothbrush. I think it's really interesting to note that some electric toothbrushes nowadays actually have a sensor on them. So if you're brushing too hard, they'll light up a certain color or kind of make a funny noise or something. So really good maybe recommendation for that viewer that was talking about gum recession to look into.
Yep.
All right, let's look at another question here. Okay, so I don't know the age of the individual asking, or I'll read the question, then I'll kind of let you know what I'm saying. It comes from Mitchell, South Dakota. It says, my son needs false teeth because his teeth were rotten. How should he go about getting dentures? What would be the best thing if someone has reached that point in their dental care where dentures might be their next best option? How do they do that process? What does that look like?
The first step would be just making an appointment with a general dentist to take probably a panograph or just a big x-ray to check, the teeth, the condition of the teeth.
Yeah.
From that point, deciding on, if the patient is comfortable having all their teeth removed at the same time and going, with nothing for a while they heal, if they want to do an immediate denture, kind of just seeing what their hope is as far as pursuing dentures, and then just coordinating. Most people would like to be put to sleep, with the oral surgeon to have all their teeth taken out.
Yeah.
So just making those referrals and.
Okay.
Yeah.
It's a lengthy process, but I think at the end of it,
Yeah.
if dentures are your best bet, it's worth it. Would you agree?
If you don't have another option.
Yeah, sure.
Yeah.
Okay. Dr. Johnson, I think this one leads back to when you introduced yourself, you mentioned rheumatoid arthritis.
All right.
So a caller from Rapid City asks, what is the relationship between rheumatoid arthritis and periodontal disease? And why is there that relationship?
They're actually very similar. If you look at the cause for rheumatoid arthritis, it's an autoimmune disease, and it attacks the connective tissue in your joints, and that disease process doesn't know the difference between your joints and the tissue in your joints versus the tissue around your teeth. And so that same destructive process that's breaking down the joints can be breaking down the tissue that's supporting your teeth. Same autoimmune response. A lot of clinicians believe that bone loss, tooth loss is really closely related to the host response, to how the person responds to bacteria in their mouth or autoimmune disease. So we had, when I was doing a lot of my research with rheumatoid arthritis in school, we actually had trouble enrolling a lot of patients into the study because the patients that had rheumatoid arthritis a lot of times were already missing too many teeth. So it goes hand in hand.
Okay. Dr. Harris, I'm going to direct this one to you. It's, why are my teeth so sensitive? How do I keep them from hurting so much?
Well, there can be a lot of causes of sensitivity. So I would say the first step is just to make sure you were seeing your dentist regularly, just to make sure that the sensitivity isn't caused by a cavity or significant recession. Make sure that there's nothing, that can be maybe easily fixed that's leading to that. But some people just have sensitive teeth, myself included. I have sensitive teeth. So there are products that do help, like the Sensodyne toothpaste. Just being mindful of the things that you're eating. Like, I would probably rather have a room temperature apple than a refrigerator, which is annoying, but sometimes, unfortunately, it's not always a bad thing, but it can be. So I would just say, see your dentist, rule out anything that could be causing the sensitivity, and go from there.
Leading into the next good question from an email viewer, what is the best way to whiten my teeth?
There are a lot of options.
There's so many out there.
There's so many options. There are the over-the-counter products that we always say, if they're approved by the ADA, they're probably, safe to use. Go ahead and try them. They probably won't hurt anything.
Okay.
They might make your teeth sensitive, of course. Can
you damage your teeth by whitening them too much or too often or for too long of a period of time?
I think probably not.
Okay.
The enamel is pretty resilient as long as you're using safe products.
Okay, sure.
So, but most people aren't going to bleach every day for,
Right.
So,
right. Absolutely. All right, so a caller from Watertown asks, I had a root canal done a year ago. It is still sensitive. Would I have to see a specialist for that, or maybe just some recommended next steps for this patient?
My first recommendation, see your general dentist. Usually, when it's still hurting after it's been that long, they'll take an X-ray. You back me up on this one.
Yeah.
They'll take an X-ray. They'll make sure that there's not any residual infection. Typically, when there's still pain with that tooth, it's because there's something still irritating the surrounding tissue. So, first step, get an X-ray with your general dentist, and sometimes there can be check the bite.
It's just the bite.
Oh, okay.
Sometimes there can be a crack on the tooth you just can't detect unless you're physically with the dentist and have it evaluated.
Right. Okay. A viewer asks, at what age should my child first go to the dentist? This is always a fun question.
The American Academy of Pediatric Dentistry recommends the age 1 dental visit. Okay. So a lot of that is education, more so for the parent, of course, but also just getting the child or children comfortable coming to the dentist and establishing that dental home. So the idea is just making them comfortable, they gain trust so that someday maybe they do need a filling or, something done, teeth taken out for braces, that they, are comfortable coming and it's not that big of a deal and you can get through it. So.
And for those children, you mentioned it's usually just a visit for comfort. At what age did you really kind of start trying to really do those dental cleanings with the child?
That's a good question. At age 1, we typically will do like a knee-to-knee exam where we do look and maybe use a toothbrush and count, any of the teeth that they have. Go over, make sure they have fluoridated water, make sure they're using a fluoridated toothpaste, just a tiny amount, not going to bed with milk or juice, those types of things. And then, really it depends on the child. There are some 2-year-olds that'll hop up in the chair and they let you do everything. And, then you have a 6-year-old that doesn't. So it's
very dependent on the child.
It kind of is, yeah.
Okay. All right, so this is from an email question. How do I prevent, how do I prevent tooth decay as I get older?
Yeah. I see a lot of it in our practice. As a periodontist, we're dealing with bone loss, tissue loss, so a lot of times there's patients as they get older, they'll have exposed root surfaces which are softer than enamel. And so we're always watching out for root decay, which is really tricky. The best thing you can do is brushing every night, using a fluoridated toothpaste, going in regularly to your dentist to make sure that those small areas of decay don't turn into big areas of decay. Right. And if they go too long, then they end up becoming areas where you have to have a tooth pulled because of the amount of decay. So
root decay goes so fast too. Yeah. But one thing I really see often as people get older is dry mouth. So just managing the dry mouth, which is often caused by medications. So kind of figuring out some things that you can do, drinking water, of course, all the time. There are some products that help with the dry mouth, but that can be, I think, a big part of why all of a sudden in older people we start to see a lot of cavities.
It can just be frustrating.
Yeah.
You can do everything right, and you still need to take your medications, and you're doing that correctly, but sometimes it can be at the cost of dry mouth and advancing decay.
Well, thank you both so much for such insightful information. We'll get to more viewer questions soon, but first, Brookings dentist Brock Tiedstrom shares a deeper insight on the topic of cavities.
Cavities can occur even with good oral health. Brookings dentist Brock Tiedstrom says there needs to be 3 things in the mouth for a cavity to form: bacteria, sugar, and acid.
The type of bacteria that forms cavities is called Streptococcus mutans, and it's a specific oral bacteria, and certain people will have higher populations of that strep mutans than others. And so someone who has a low population of that specific type of bacteria will form cavities at a less rapid rate than somebody who has a higher percentage of that type of bacteria in their mouth.
His practice usually sees children with cavities because kids may have difficulty getting their teeth clean on their own, or they have not been properly taught dental hygiene. He says teenagers and young adults commonly get cavities, but as we age, our teeth are more prone to cavities.
And so older folks may have a more dry mouth, and their body doesn't have the natural saliva flow in order to get clean on its own.
Along with less saliva flow, medications that cause dry mouth can lead to cavities.
Nighttime brushing is the most important time to brush your teeth.
He says it's important to brush your teeth before going to bed because there is little to no activity in the mouth.
The mouth is a place that always tells the story of your life from the very beginning.
Dr. Teedstrom, thank you for that wonderful information there on cavities. So my question for both of you, is there a correlation between tooth decay and cavities?
Well, and
Oh, I'm sorry. I read that question wrong.
No,
Is there a
that's okay.
difference between tooth decay and cavities? Thank you for.
Oh.
Yes, sorry about that. Is there a difference between tooth decay and cavities, or are they kind of all lumped under the same umbrella?
So a lot of times when you go to the dentist and they'll say, you have decay, it's the physical bacterial process of the tooth breaking down. From like a strictly scientific standpoint, a cavity is any part of the tooth that has like a concavity. That's where the word comes from.
Okay.
So there can be notches in teeth, and those are concavities. They're technically a cavity, but it may not be decay.
Oh, okay.
Is that fair?
I suppose.
I think, yeah.
I feel like most people
Great way to
hear
answer
the
that
word
question.
cavity, they think cavity, decay.
right,
You know.
right.
I think
Exactly.
if you say the word cavity to a dentist, they're going to know what you're talking about.
Yeah.
Yep.
Yeah.
All right, let's move on to some more questions. This one comes from Facebook. I have a small space between my back teeth where my wisdom teeth were pulled years ago. This space gets irritated easily. Is there anything I can do to prevent this small space from getting irritated and hurting?
In the way back.
Back, like where the
Distal
wisdom
wedge.
teeth.
Yeah. So that's as in the world of perio, that's a very common referral that we'll see from our referring dentists, and a lot of times it's the result of you're missing that wisdom tooth, and you will have food impaction in that back area because there's a lot of excess tissue. And so the best preventative measure to keep that from continuously becoming inflamed is just keeping it clean. Sometimes a water pick. It's really difficult to get floss back there. So from just a practical standpoint, a water pick is kind of nice. Even some of those smaller electric toothbrushes with the smaller heads make it really easy to get back there. And then there are procedures if it gets to the point where you can see your friendly neighborhood periodontist and they can do what's called a distal wedge, which is removing some of that excess tissue.
Oh, interesting.
So.
Very good to know. All right, Anne, you're going to like this question. It comes from Facebook. It says, my child plays hockey. He's only 5. Does he need a mouth guard? Does a dentist do this, or can I buy it online somewhere?
Nice. Yes, absolutely. He needs a mouth guard. So actually, I kind of wish they would wear them for every sport because, we see a lot of mouth injuries. So, but a lot of people will get the over-the-counter mouth guards. We will make any child a custom athletic guard because they are so important. And the custom guards actually offer a little more protection as they cover the alveolus or the bone that supports the teeth. So in a sporting injury, you won't necessarily just damage or break the teeth. You could potentially fracture the bone that holds the teeth in place.
All right.
Yep.
I love the
very important.
I do. I agree with that. Mouth guards are extremely important for all sports. All right. So a caller asks, could the doctor talk about gingivitis? Could the doctors talk about gingivitis? What causes gingivitis, and how do I get rid of it?
That's you.
That's my wheelhouse.
That's you.
Gingivitis is the inflammation of the gingiva. So anytime you hear itis on the end of something, that's inflammation. But typically gingivitis is the result of bacteria or plaque that forms along the gum line. And the best way to prevent it is just continuously removing that plaque and brushing twice a day, 2 minutes, twice a day. You get brownie points if you're flossing along with that. But gingivitis is always a precursor to periodontal disease. It's kind of the first clue that something else may be going on.
Okay.
So.
Okay. We've been talking about water picks a lot, and we do have another question on water picks. This comes from Facebook. Can water picks cause gums to recede? Or in patients that have periodontitis, should they just avoid water picks? Is that something you talk about a lot with your patients?
Yes, actually. Water picks, in my experience, I haven't seen anything cause recession without that person already having thin tissue or inflamed tissue. It can really be a double-edged sword, because if you're avoiding that tissue, if you're not cleaning it, it can actually cause that recession to advance quickly. It can actually speed up the process if you're actively avoiding that area and trying not to clean it.
Yeah.
So
yeah.
It's an issue that I see commonly.
Okay. All right, let's see. From Facebook, what are my options if I need a missing tooth replaced?
You want me to go? Well, of course, it depends on where the tooth is, which tooth it is in your mouth. And the first step would be just to see your general dentist to discuss options. Because there are a lot of options as far as replacing missing teeth. And sometimes something removable can be, a very economic way to replace a tooth, or a good way to replace a lot of missing teeth at once. Implants are awesome. They, I would say, are kind of the gold standard as far as replacing teeth. I think that's what everybody would want if they could
They've
have a
done
choice.
Studies, and that it will show that implants behave the most, for a tooth replacement, they are the most natural feeling.
Yeah.
They will never replace a natural tooth to 100%, but you will be able to floss between an implant. You'll be able to chew aesthetically. They'll look like natural teeth. But usually, if that's a recommendation, if it's possible, that's an ideal replacement.
Yeah, I agree.
All right, so there's another question in here from Tony from Rapid City. This is a good follow-up question to the one we just asked. Tony asks from Rapid City, what is the waiting period following an implant before a crown can be placed? Is it immediate, or do they have to wait till it heals? How does that work?
Tony's going through it.
Yeah, he might be getting an implant, perhaps.
The good question.
That is a good question.
Yeah.
And I don't know, we typically, from the time the tooth is taken out until we recommend an implant be placed, we say about 3 months of bone healing.
Okay.
The implant can be placed, and then typically it's about 3 more months to let the bone integrate to the implant.
Okay.
And then at that point, we start the restorative process. But he's the expert, so, and I know there are a few unique circumstances where they may do an immediate placement.
Oh, sure.
But
As a general
not.
rule, we usually say 3 months of allowing the implant or the socket to heal, and 3 months to allow the actual post or the implant to heal. But there are circumstances where you can take the tooth out and put the implant in during the same procedure. But as a rule,
Saves a little time. But
Yeah. I like this next question because I think there's a lot of people that deal with it and they maybe don't know how to tackle it. This comes from Facebook. Could the doctors talk about bad breath and how do I get rid of it? Let's talk about what causes bad breath and then how we can tackle it.
Yeah, that's a good question. And I feel like a lot of people might be nervous to ask about it, but it is a very real thing. Most importantly, again, seeing your dentist or hygienist, first making sure that your mouth is clean, have your teeth cleaned or evaluated to make sure there is no, gum disease or periodontal disease. The tongue actually can be a culprit with all of the, crips and valleys. So making sure that you have, tongue care and
scrapers.
Tongue scrapers.
Yeah.
Really, once you rule out everything in the oral cavity as far as gum disease, infected teeth, that sort of thing, then you kind of start looking back at things like acid reflux, or a lot of people get tonsilloliths or tonsil stones, which can be stinky.
Yeah, they have a smell to them.
But really starting with your dentist, I feel like it's a good place, easy place to start.
Exactly. Yes, exactly. Trusted. Yep. All right. So this is a caller from Rapid City asking, is gold still used for crowns? Or I'm also going to throw like fillings in there. Is gold still used for some of that restorative work? And if so, why is it so? Why, since it is expensive, Why is it expensive and malleable versus other materials? Let's discuss the first part of that question first. Do we still use gold for crowns or fillings? It just as a rule in dentistry.
I do not do very many gold fillings.
Okay.
Anymore with the composites. That's kind of what most people want. And most people don't want to pay for a gold filling. When the composites are pretty, do the job just fine.
Does a composite last as long as a gold filling, or what's the research there, the studies on that?
I don't know.
Time will tell.
Time will tell.
My joke, I have a lot of older patients, and they proudly show off, like, this is the crown that I had done in 1967, and I'll tell them, well, you better send that dentist another bill. But no, we see some of that dentistry can really last a long time.
I do. I just did a gold crown today.
Oh, wow.
Yeah,
Awesome.
I do still do some gold crowns.
Okay.
So,
Is there a decision made for a certain reason why gold versus a composite material when you do some of that restorative work?
That is a good question. We always leave it up to the patient. Like, some patients don't want the color. They want it to look natural. They want it tooth colored. Sure. But gold, it's been around a long time, and we do see gold crowns that are old. They've been in the mouth a long time. They withstand, the occlusal forces. They are biocompatible. The reduction on the tooth is minimal.
Okay.
They're durable. I have a gold crown.
Do you?
I do. So
Looks good.
I've had it over 20 years.
Oh, that's incredible. Okay, good to know. Great information there.
Yeah.
All right, this question comes from email. My gums always seem to bleed at least once a week when brushing. What could be the cause of this?
Well, there's definitely gingivitis going on.
Okay.
Like if you're having bleeding while you're brushing your teeth, it could be possible that you're brushing too vigorously. But typically, if it's that often, I would peg that on gingivitis.
Mm-hmm.
A bigger issue could be gum disease, like periodontal disease, where you're starting to lose bone or attachment. And about the only way you can determine that would be if you're meeting with your general dentist and
Sure.
and making sure that they're taking x-rays and probing. So.
Yeah, absolutely. Okay. From Facebook, my dad is in his 70s and has noticed that some of his teeth are loose. What could be causing this?
It's you.
Most likely there's been bone loss.
Okay.
Typically, I'm an analogy guy, and you don't see structures like houses starting to wiggle and wobble if the foundation is solid.
Mm-hmm.
It will, with teeth, it's the same thing. If you're starting to see teeth mobility, it's usually because you're having bone loss, or there's inflammation, or there's an issue with the bite.
Okay. This is a good question from Facebook from one of our viewers here. It says that they're going to be having a root canal done soon, and they want to know what is involved when you get a root canal.
I feel like root canals tend to get a bad rap. Like, everybody compares, like, oh, I had to have a root canal, or it sounds so horrible. But usually, like, more often than not, it's the pain that you have before you have the root canal, like that toothache that you get. That's so horrible, not necessarily the procedure itself. So I would tell them, of course, if it's their first one, they're probably nervous, which is expected, but they should be numb, they should be comfortable, they shouldn't feel anything during the procedure. I
get often asked by patients, should I just have an implant?
Yeah.
Good question.
And I always say,
I get that too.
as a person that places implants, I'm biased.
Right.
But I would much rather have someone keep their natural tooth, and if that means having a root canal done over an implant, then absolutely. I'll have a root canal done if it can be done.
If there's a good prognosis.
Yep.
Sure.
If the tooth is healthy enough to withstand it, then absolutely keep your natural teeth and use them.
Yeah.
I had a root canal in high school, and then we're still going strong on that tooth. So here we go. Once again, thank you for all the wonderful information. Keep sending your questions in. And Dr. Bradley Jordan dives into advancements within dental implants, making the procedure easier for patients.
Dr. Jordan, owner of Lone Oak Dental in Brookings, has a passion for healthy smiles. This led him to get training beyond the basics of becoming a dentist. He wants patients to know that dental implants are normal and are a common procedure.
I think it's important to recognize that millions of Americans are missing one or more teeth. It's not something you have to be ashamed about. There's lots of options for tooth replacement.
Dr. Jordan says patients decide to get dental implants for various reasons.
I would say most of the people we're doing dental implants on are people that are middle-aged or older, usually people that have had a tooth break. They've had a tooth that had a root canal and the root canal wasn't successful, and so we take the tooth out and then plan the place for a dental implant.
Now there is advanced technology that makes the implant process not only easier for the doctor, but also for the patient.
20, 30 years ago, when we wanted to replace like a full arch of implants, we had to do 8, 10, 12 implants and then hook the teeth onto that. Now we can do that with as little as 4 to 6 implants for full arch of teeth.
Dr. Jordan says you can care for artificial teeth the same way as natural teeth. A water pick is recommended to get in those hard-to-reach spots. Annual checkups are essential to ensure the implants are holding up well and your bite is correct.
3D imaging, which is a 3D x-ray machine, we're taking on every patient to make sure we have enough bone. We're going to stay away from vital structures, things like that. We're doing a lot more immediate implants where we're taking the tooth out one day on the day of the surgery, and then we're putting in the implant the same day in the same site.
All right, thank you, Dr. Jordan, for that great information there. We're going to return to some of our viewer questions now. This one comes from email. I have been told that I might need gum grafts. Could the doctors talk a little bit more about what are gum grafts and why would you need something like that? What are some of the causes?
Gum grafts are probably the most common procedure that I see on a daily basis. When people have thin tissue and they're starting to see more root exposure on their teeth, that tissue that is around the teeth is there to support them. Like if that tissue is gone, it means there's less attachment. Mm-hmm. That means that those teeth have a higher risk of being lost at some point. Almost never hurts. Maybe there's a little sensitivity. But typically with gum grafting, the whole purpose is to reinforce those teeth. We want to keep them where they're supposed to be, and so we will often do what's called a connective tissue graft. And it's taking your own tissue and we transplant it over the area where there's recession. And again, the whole purpose is to reinforce what's been lost. And oftentimes the new tissue that's placed is actually stronger than what was there originally. So a lot of the studies point to, the longevity of these grafts, and they last dozens of years. They hold up well. There's a lot of research behind them. There's a reason why we do them. Mm-hmm. And so the whole purpose is to maintain your natural teeth, and they work well.
Is that something that's done just in a local area if there's mobility, or is it something that's done all throughout the mouth?
Typically, it can be all throughout the mouth.
Okay.
I have criteria that I look at when there's recession. A lot of times if there's inflammation, sure, meaning the gum tissue's red and it's angry or it's symptomatic. So if someone's avoiding that area because it hurts when they brush, yeah, those are big indicators that a graft might be needed.
Okay.
If it's asymptomatic, and meaning it doesn't hurt at all, it's the tissue around it's nice and thick, and there's a little bit of root exposure, that might not be significant enough to justify doing a graft.
Sure.
But one of the things we look for is just if it happens suddenly. The age of the patient is often a factor. Younger people will often need them in the lower anterior area.
Yeah.
And if they're sensitive, a lot of times if that root exposure is causing sensitivity, we can place tissue to cover the exposed root.
Okay. From Facebook, when should I get braces for my child? Does it matter what age they need them if our dentist has recommended it? For example, if your child is 8, your dentist says it's time, can you wait until they're 12, or should you kind of start that process right away?
Sure, sure. You know, like a lot of things, every case is different. So we always try to do a really good job monitoring patients, which again is another reason why it's so important for kids, especially to come to the dentist regularly, just to kind of monitor their growth. There are some, you know, say 7-year-olds that as their permanent teeth start to come in, you can tell that they're going to have major issues with crowding, or maybe they're missing like a permanent tooth, or maybe they have an extra tooth, or they have like a severe underbite. So in that circumstance, we might refer you to the orthodontist early. You know, if it's maybe just a little bit of crowding or something pretty minor, we might wait till the child has lost all of their baby teeth, which is typically around age 12, and then refer them at that point. Usually if I refer them to the orthodontist at 7 or 8, there's, you know, a reason. And if it can make the process easier on the child, you know, maybe there's some like early ortho intervention that they can do early on that might, you know, make it easier when they're 12.
Yeah, just a case-by-case basis. Visit your dentist and get their recommendation. Perfect. This is a good question. I hear this a lot, and I think it's important to talk about this. It comes from Facebook. Are dental x-rays safe?
I would say yes.
I'm a little biased, but I would say yes.
Yeah.
There's a lot of research that shows a typical bite wing that they do in a normal dental office, normal checkup, has the equivalent exposure of stepping outside for about 5 minutes. Sure. So the environmental radiation when you're outside is about equivalent to a dental x-ray. So I think when you think of it in those terms, they're very safe. There's different scales of, you know, there's chest x-rays that you get at the hospital, and a lot of times when we go through our training, they're comparing the amount of exposure for a dental x-ray versus all the way up to these chest x-rays. And a dental x-ray is
very minuscule compared to others. So. Absolutely.
Sometimes you'll see too people who don't want x-rays, which I mean, that's their choice, but then it always is heartbreaking when all of a sudden you're like, ooh, or they have a toothache and you take an x-ray and you're like, well, now we have to take this tooth out because the cavity is so far, you know.
Right. With the risk involved, it's probably the best way to see inside of a tooth and
between
to
the
see
teeth.
decay and between the teeth. It's recommended by most, if not all, dentists for a dental x-ray to be taken. How oftentimes is there a recommendation from the American Dental Association?
It really is, again, kind of case dependent. I mean, you might have a 40-year-old who's never had a cavity. Like, do they need x-rays every year?
Yeah.
Probably not, you know, so, but typically once a year is pretty average, I would say.
Perfect. All right, so let's switch gears here just a little bit. From email, how long should a crown last?
Well, I would like to say forever.
Yeah, that would be ideal.
That would be ideal.
Yeah.
It would be ideal if they lasted forever. And I mean, for the most part, again, I have my gold crown that's over 20 years old. Yeah. You still have to brush, you still have to floss. Can you get decay around a crown? You can. I mean, you still have to take care of it, but I think like dental insurance will consider 5 years a success on a crown. So if you have to have it replaced after 5 years, they'll typically, is that right?
I'm just thinking of the analogy of tires. How long do your tires last? And it really depends on how many miles you're putting on a year. You might get them to last 40,000 miles, and that might be 10 years of use. And so it just like teeth.
Yeah.
Some people chew ball bearings, and
that is true.
Yeah.
People who grind or clench their teeth are a lot harder on porcelain.
Oh, sure.
Materials is really important.
Yeah,
absolutely. All right, here's a question from Facebook. My child has to have his wisdom teeth out. What are wisdom teeth? And why do we need them removed? Some people don't ever have their wisdom teeth removed, but some need them out. Why is that?
Yeah, no, that's a really good question. I would say as a general rule, around age 17 is pretty average to recommend people get their wisdom teeth out. Most people don't have room for them. So the idea is to take them out at a time where the procedure is going to be easiest on everyone, easier on the patient because the roots aren't fully developed, easier on the surgeon because they come out nicer, the recovery, they're young, they're healthy, rather than waiting until they're 20, 30, 40 and it's all of a sudden an emergency because it gets infected, because it's not in completely. Of course there are exceptions, but as a general rule, I would say most people just don't have room for them anymore. So.
Absolutely. All right, so from email, my child wants to try charcoal toothpaste. Is this a real thing or is it a trend from influencers?
TikTok?
Like TikTok.
Yeah.
TikTok, YouTubers.
Maybe we should talk about what is charcoal toothpaste? What is the trend that we're kind of talking about here and what's the allure to it?
There are, like Crest Colgate even they have charcoal toothpaste. I can't say it makes a huge. What's your take on
my what do they call it? Hot take?
Hot take.
Yeah. What's your hot take on charcoal?
I tend to recommend toothpaste that's bland, toothpaste that has fluoride. If it's super zesty, I see a lot of patients that have what's called lichen planus and mucosal issues that can be related to inflammation and irritation from a lot of intense flavorings in toothpaste.
Wow, never knew that.
Yeah, so I try to stick to a bland toothpaste. Fluoride is the most important ingredient.
Yeah.
If flavoring wise, really the flavoring's offering a little bit of taste, a little freshens the breath, but if you're having abrasives in your toothpaste, that's going to wear down on the enamel. If you have peroxide in your toothpaste, that's going to cause gum inflammation. So to be on the safe side, I usually just say bland is better when it comes to toothpaste.
Okay, good to know. And
I will say my 10-year-old watches, he follows Dental Digest
Uncle
on
Paul.
He follows a YouTuber dentist who he loves, and there's a toothpaste called High Smile. It has fluoride in it, but it comes in all sorts of fun flavors like bubble gum, red velvet, vanilla.
Yep.
It's so good.
Oh, it is.
It is so good.
I might have to try some of that.
But so if the mint, but it's so
Okay.
TikTok.
A caller from Avon asks, what impact do osteoporosis medications play in dentistry? That's a great question.
Ooh, that's got a lot of levels to that question.
Yeah, it does.
That is a good one.
Yep.
So osteoporosis is the breakdown of bone, and it's kind of how the bone wears down. Different osteoporosis medications prevent the bone from breaking down, which if you have gum disease, if you have bone loss from periodontal disease, it's going to slow down that body's process of bone loss around the teeth. The point where dentists get a little bit more nervous about it, it can cause osteonecrosis. So when you have a tooth pulled and you have a socket there, the socket normally fills in with bone because it's healing. Well, a medication that's intended to prevent bone from filling in is going to leave that area exposed, and that's where complications can get exciting.
Okay. All right, this is a good question here from email. My lower front teeth are migrating. One is loose and it had to be pulled. Others continue to migrate. Is it better to wait until they each loosen up and need to be extracted, or should I proactively pull them all now and have a bridge put in that area? This patient is 85 years old. What would you recommend?
I would say first see your dentist, because if natural, your body's natural health is not losing body parts.
Sure.
Your fingers don't fall off on their own.
Yeah.
Your teeth shouldn't fall out on their own. And so there might be something more going on with those teeth.
Yeah.
And it's probably bone loss if they're migrating, and inflammation if they're starting to split. And And I often tell my patients, like, I don't want you investing a lot of money into something if those teeth are going to end up falling out. So a good exam with your dentist is going to make sure there's nothing bigger going on and probably save some time and headache in the future.
Yeah. Okay, so we touched on this just a little bit, fluoride in toothpaste. This viewer from email asks, when I was younger, it seems that we talked more about fluoride. Why is it different now, and are we getting enough? Do we need more? Fluoride is a great topic in dentistry. Recommended that we get fluoride treatments on our teeth. We use fluoride in our toothpaste. Why? Why is it important for dentistry?
It is very important in preventing cavities and keeping the enamel strong and healthy. Anymore, most people have it in our water supply. Sure. So that, I mean, I don't know how old that person is, but that could be why it's not discussed as often, just because most people do have either rural water or city water that already has the fluoride in it. Yep. Where I feel like a lot of people, like when we were kids, we had well water, so we had fluoride tablets that were, you know, that we took. So maybe that's a big part of it, which is great. It's, you know.
I think people are getting exposed to fluoride in a good way without even realizing it. Again, with the water and even bottled water has fluoride in, as long as it's not distilled. So.
Yep. All right, we got to just briefly here, we'll answer this next question from email. If my mom has gum disease, will I get gum disease? Is it hereditary?
Well, I often tell patients, one of my questions that I often will ask is, do your parents have their teeth? And tooth loss and bone loss are a lot of times related to genetics and how well your immune system responds to bacteria. Sure. And so just like if you have someone that's prone to getting sick all the time, and the bacteria in your mouth can run rampant if your immune system is taxed. Okay. And so if you share your mom and dad's immune system and genetics, and a lot of times you'll see that run in families, that if one group of the family is more prone to bone loss, sometimes the kids can be more prone to it.
Okay.
Yeah.
Well, thank you. Great information there. We always appreciate both of your insight and knowledge on dentistry. Great information. Our winner is Emily. Congratulations. A book will be sent to you shortly. We'll be back after this.
On Call with the Prairie Doc has been a leading source of health education for 22 seasons. Join us this season as we continue to provide health education based on science, built on trust. Follow us on Facebook, Instagram, YouTube, and TikTok to access the entire Prairie Doc library.
Thank you to our guests, Dr. Harris and Dr. Johnson, for volunteering their time to help us learn more about oral health. It was so great to have both of you in studio. Thank you for being here.
Thank you for having us.
Yes. If you would like to see and hear more episodes of this program, please like and follow us on Facebook, Instagram, Threads, YouTube, and TikTok, or visit us at prairiedoc.org. Look for Prairie Doc Perspectives in your local newspaper and online. Listen to us on Prairie Doc Radio on SDPB Sundays at 6 a.m. and 1 p.m. And be sure to look for the podcast of this program, Prairie Doc On Call, wherever podcasts can be found. From all of us here at On Call with the Prairie Doc, thanks for joining us for another episode of health information based on science, built on trust. Until next time, stay healthy out there, people.
AI and technology promise to change the practice of medicine in unknown ways, but many of its practical applications are still in their infancy and are being explored and developed by medical professionals. Technology and artificial intelligence in medicine.
My name is Dr. Tad Jacobs, and I serve on the Healing Words Foundation, the nonprofit that runs Prairie Doc programming. Our mission is to enhance health and diminish suffering by communicating useful, science-based information respectfully and compassionately. Your donation supporting Prairie Doc programming makes an extraordinary difference. Gifts of any size enhance its impact in our state and beyond. Thank you for your generosity.
Major funding for On Call with the Prairie Doc has been provided by
At Avera, our nationally recognized health system will be right here with you, with care and coverage. Hello possibility. Hello healthy. Hello life. Avera, moving health forward.
Larson Manufacturing is proud to support On Call with the Prairie Doc as it continues to open doors for important medical information. And with the ongoing support of these individuals and institutions, Brookings Health System, South Dakota Academy of Family Physicians, Ophthalmology Limited, Avera Medical Group Brookings, Avera Heart Hospital, First Bank and Trust, Dakota Allergy and Asthma, Monument Health,